Hi, everybody, and welcome to the first episode of Season 2. Congratulations for making it through Season 1. Just a word of advice about Season 1 is that it's a long season. There's a lot of stuff in Season 1, and Season 2 really helps us foundationally with the rest of the semester. If some of you don't realize, I'm calling each chapter season, and each lecture, episode 1, 2, 3, and so forth. So don't despair if you feel like you need to spend more time in season one, the previous season. There's no rule that says you can't spend more time there. Plus, they're recorded. Watch these as long as you want. If you need to, by all means, do so. But we need to, for the interest of time, start with season two. All right. I'm glad the little alien spaceship is moving. There it goes. Okay. He didn't move from his line. So in this lecture, we're going to be talking about planes and directions. We'll talk about cavities, regions, and body positions. If you've already had anatomy and physiology, this will be a review. If you haven't had AMP yet, this will definitely help you when you get there. I've had students say, I wish I'd taken medical terminology before I took AMP, but it's like a chicken and egg kind of thing. And it's hard to say which should come first, but this will help you and hopefully either help you or refresh what you've learned in the class. All right, so there are three different planes we're going to discuss anatomically. The first one is the coronal plane. This is also referred to as the frontal plane. Coronal has a suffix al, which just means pertaining to, and corona, which means crown. So the coronal plane divides the body into front and back. You can visualize this plane as wearing a headband that goes from ear to ear like a crown. The front part is either called the anterior or ventral region, while the back part is called the posterior or dorsal region. And sometimes people may get a bit confused between ventral and dorsal. So before delving into that, it's essential to understand that these terms are pairs. So front and back, anterior and posterior. And then let's discuss ventral and dorsal. The reason you learn them as a pair is that it's easier for you to recall. If you know one, you'll know the other. So I always try to point out whenever I think it's going to be beneficial for you to learn things as pairs. In this case, learn it as a pair. If you have a little brain hiccup and remember that the front part is anterior, but you can't recall the back part, just knowing anterior will prompt your memory to say posterior. So now in terms of ventral and dorsal, this will help you later. Remember that the dorsal region is your back. If you were to be eaten by a shark, no, I'm just kidding. If you were a shark, your dorsal fin would be on your back. Think about how you swim face down, so the dorsal fin would be on your back, and if you remember that dorsum is the back, you remember that ventral is the front. And I hope that helps. Now, in terms of movement through the coronal plane, we can talk about movement being AP, anterior posterior, meaning from front to back, or PA, posterior anterior. The way it's spelled here is correct. Typically, you don't see two vowels together in the middle of a word like that, but it's correct. So, posterior anterior, meaning from back to front. A good example of when this is used is in a chest x-ray. A physician might order a chest x-ray AP, meaning that they want the x-ray images to go from the front through to your backside. So I hope this makes sense. That is the coronal plane, the frontal plane, making a front and back part of you. The transverse plane, also called the axial plane, is a term you'll hear used interchangeably. Transverse is an interesting word because if you looked it up and broke it down, you'd notice verse as our suffix, which means to travel or to turn through, and trans means through. So this is one of the exceptions to the rule that says that we have to have a combining form. I know I told you in the previous chapter that you have to have a combining form, but just like in English class, there are rules and there are exceptions. So this is the exception to the rule, and I wanted to point it out because it's a bit unusual. It does happen, but it's very uncommon. So anyway, the transverse plane divides your body into superior and inferior sections, meaning upper and lower sections. This is like the magician who cuts the lady in half. You have a top part and you have a bottom part. And I assume you already know what superior and inferior mean in terms of direction. With this plane, we will talk about cephalad, meaning going superior or towards the head. Cephalo means head. And kadad, despite saying feet here, it really means tailbone. So you're going from the top to the bottom. So if I said I wanted to discuss an anatomical list of organs and use cephalocado, that would be head to toe. Cephalad meaning moving towards the head, and kadad meaning moving towards the feet. So the transverse plane is like a magician cutting the girl in half. Hopefully that made sense. Alright, why? I can't go to the next slide. What the heck? Okay, hopefully my recording is moving smoothly. The third plane is the sagittal plane, which divides the body into right and left, with the mid-sagittal line running exactly down through the middle of the body. In terms of this plane, we will talk about something being medial or medially, meaning moving from the side towards the midline. On the other hand, lateral or moving laterally is moving from the midline towards the outer side. So we're in the sagittal plane, and in terms of movement, we're talking about the midline. Medial, think of the M and medial as being very similar to midline or the middle. So those M's will probably help you out. Lateral is away from. We'll also have two little terms that you might hear: bilateral, unilateral. Right? Bilateral means both sides. In terms of diplomacy, you'll talk about bilateral peace. Negotiations, you might have heard stuff like that in the news recently. So you're having by me too, meaning both sides. So unilateral is being one-sided. Sometimes when people get upset and feel they're not at the negotiating table, they might say these are unilateral negotiations, meaning one-sided. So again, bilateral, both sides; unilateral, one side. And my slides are moving along. All right, I just put this picture here. We know some of you, well, I don't know, some of you might actually be going into veterinary technology. And this is not in your textbook. I put this in there as a little extra. But you can see we still have the median plane, the transverse plane, the dorsal plane. And we can see caudal there, meaning toward the head. Rostral here, meaning toward the nose, right? Cranial, we have the dorsal side, ventral side. You can see all the terms here. Proximal meaning toward the trunk, distal meaning away from the trunk, palmar toward the paws, right? Interesting, very interesting. All right. For those of you going into veterinary technology, just wanted there to be something for you all as well. All right, other directional terms that we need to know are, that we saw in that last picture, distal and proximal. And just to be clear, it's not approximal, referencing like the trunk or torso of your body. Distal is more distant, further away, so you can use the word distant to help you remember it. Proximal is approximate, closer. Again, I try to provide a little visualization here that will help you remember the distal and proximal relationships to the trunk. So we would say that the hand is distal to the elbow or the shoulder. You could then say that the foot is distal to the knee. The knee is closer to the trunk. So the trunk is the location that we're referencing in this case. All right, other directional terms include ipsilateral and contralateral. Ipsum means the same or self, so ipsilateral means it's on the same side of the body. For example, if I had an injury and fell on my right side, breaking my right shoulder and arm, we would say the injury was ipsilateral to the side of the fall because it's on the same side. Contralateral, on the other hand, is the opposite. So think of contra as contributing against, which is similar to contraband, or contraindicated, meaning against. In cases of brain injuries, the right side of the brain affects the left side of the body and vice versa. So if I had a right-sided brain injury, I would have left-sided contralateral problems. So it's essentially it's essentially the opposite or against the affected side. All right, so very quickly, let's go over cavities. A cavity is not actually hollow, right? It's filled with organs, but they call it a hollow area where you have organs and organ systems are housed. So cavities are nice and easy to remember because oftentimes they are named after their contents. So in terms of this cavity, it's the cranial cavity, and you can pretty much guess what's there. The brain, the cranial nerves, the related tissue. So no big surprise, that's the first one. Again, we're going in cephalocaudal order from head to toe. All right, the next cavity is the spinal cavity, housing the spinal cord, spinal nerves, and some associated tissues. So you can see how nice and easy this is to learn. Right? The next cavity is the thoracic cavity, which houses the lungs. This cavity is within the ribs and contains the lungs, the trachea, esophagus, the heart, and the diaphragm, and it serves as the anatomical landmark indicating the end of the thoracic cavity. The thorax, or the chest, right, it contains major organs all the way down to the diaphragm. The diaphragm then serves as the landmark that indicates where the abdomen and the abdominal cavity begin. So this cavity contains, the abdominal cavity contains the stomach, the intestines, liver, as well as accessory organs like the gallbladder, pancreas, 2 kidneys, and adrenal glands that sit on top of the kidneys. And there are several organ systems within the abdomen. And I always like to stress that abdomen. I say it like that so you can picture the word as I'm talking. Moving forward then, or down, going in cephalocaudal order, we have the pelvic cavity. This cavity includes the pelvis, reproductive organs, urinary bladder, colon, the pelvic colon, the rectum. Many times due to the absence of a strict landmark between the abdominal cavity and the pelvic cavity, unlike the diaphragm in the thoracic cavity, you might hear them collectively referred to as the abdominal pelvic cavity, combining the two together. All right, again, if you're a very visual person, here are my cavities that you can look at again. We can discuss the dorsal cavities and then we can talk about the ventral cavities. You can see here how they lie in that cephalocaudal order. You might notice that's my word of the day. So I like that word for today. All right, now the regions are really helpful in identifying specific locations. So please do not memorize these areas right now. This will take a lot of your time and will be more useful like in your A&P class, your anatomy and physiology. Either if you've already done it with A&P or you're going to do it when you get to anatomy and physiology, do it then. If you like to memorize stuff, that's good. So I wouldn't have to do it now because then it would just be sort of getting the dust off of it later, when you refresh. But it's not going to be the best use of your time. I'm just trying to explain to you that there are specific regions that we can talk about later, and it will be a little more specific, helping you in identifying locations. So I'm not going to get into all of these regions now. I just want you to see this and sort of get an idea. All right, so when discussing body positions, we focus on those used in medical and surgical procedures. So I will touch upon some commonly used positions, as there are many more than what we'll cover here. The ones I discuss are frequently employed. As you progress in your professional life, you'll encounter positions that are relevant to your specific field. So for example, the lithotomy position with feet in stirrups is crucial in labor and delivery, but may not be significant in any other specialty. It may or may not, I don't know. If you work in oncology, it doesn't play a role. So, but you dive into different positions in oncology that you would come across that we wouldn't talk about here. But it's just important to be familiar with the major ones, the ones that are widely used, and yeah, that's it. So learning them as pairs again, learning things in pairs will be helpful. So here we see supine and prone. These like very generic terms, very generic positions. In the supine position, one lies on their back, flat on the back with arms at the side. And to remember this, you can use a rhyme like supine is on your spine, right? Meaning you're on your spine. Consequently, the prone position is the opposite of that. So face down with arms at the side. So the supine position, for instance, would be suitable for gallbladder surgery, while the prone position might be ideal for spine surgery. Or even things that are happening today in plastic surgery, like butt implants, right? You definitely want to be in the prone position. But those are just basic positions. Supine on your spine, prone is face down, face down. Okay, Fowler's. Fowler's position is likely named after a physician. I'm not really sure. Again, sometimes I should Google some of these things, but I don't want to. I try to not Google as much as possible. I'd rather have conversations with people and us figure things out. And I'd learn from others rather than learning from Google. All right, so I often think about it, but I don't look it up. So regardless, Fowler's position, it involves sitting up, and it has nothing to do with the leg position. The legs could be straight out or bent, and you could be sitting at the side of the bed. For example, in high Fowler's, there's a 90-degree angle, which is particularly helpful for individuals with respiratory problems. So in the recent COVID pandemic, these positions were extremely useful, including the prone position. We'll talk about that when we get into the respiratory system. So if you ever try to sleep with a severe cold and congestion, you know you need some pillows to help you breathe more easily. And so Fowler's position is often associated with respiratory or thoracic issues, so that hopefully that might help you make the connection. For certain procedures like inserting a nasogastric tube through the nose and down into the GI tract, Fowler's is also a beneficial position for this procedure. And there's also variations such as semi-Fowler, which is at a 45-degree angle versus a 90. And there are also other varying degrees of Fowler's. So, but generally speaking, it's where you're sitting up. All right, let's talk about Trendelenburg. So in Trendelenburg, the patient is supine, but the head is lower in the feet, right? So your feet are up. The position is used to be is used for cases where someone is hemorrhaging. If they had some traumatic accident, it could help shunt blood away from the peripheries, like from toes, legs, and arms toward the thorax. So this ensures that those vital organs are adequately perfused. On the flip side, there's the reverse Trendelenburg, and that just means that you're in the opposite direction, where the patient is still lying supine, but the head is higher than the feet. So this position is also crucial in certain surgical procedures. So these positions were once widely used, and their application has become more specific in modern medical practices. I know that Trendelenburg is also used in emergency situations for shock, patients who are in like anaphylactic shock. Don't ask me about the physiology about that, but why it works, but you can look that up. You can Google it. Okay, so that concludes the first lecture. In the next one, we'll move on to the lecture 2. We'll discuss body systems, specialties, and other related topics. And I will talk to you soon. I'm glad that my animations are actually working here. Hello there again, and welcome to Chapter 2. So here in Lecture 2 on the body and disease, remember this is foundational information that we'll be referring to throughout the semester, and you'll encounter these terms frequently in healthcare. So I hope you find this information to be very, very useful. Everything builds on this. We're going to start by discussing some disease terms, and some of these you've already heard. I'll also be pairing some of these terms like acute versus chronic, Acute refers to something with a sudden onset and a very short duration. And like an extreme example might be a mosquito bite, right? One minute you don't have one, and the next thing you know, you have one, and it itches for a day or two, and it's very quick and very short. On the other hand, something that's chronic is long and it's lingering. Chrono just means time. So chronic conditions means pertaining to time. They often don't come on very abruptly, but they linger. So chronic conditions can be termed more in terms of months. So you have different diseases that have different criteria to determine whether they're considered acute or chronic. So for instance, I could have something that happens acutely, a short duration. And let's say I bumped my knee. I actually had this happen recently. Um, I want to say I fell off my bike. I don't want to get into the story. I was riding my motorcycle and I got hit by a U-Haul truck. That's a story for another day. Let's just assume I fell down off my bike and I got a bump on my knee. And my knee hurt for maybe like a week or two. And then I had some inflammation in the joints and I had some arthritis, right? But it's a very short-term duration that came on suddenly because I hit the pavement and because it was an injury. So when people think of arthritis, though, they tend to think of something that's more chronic condition. And trust me, my hands were swollen like the Incredible Hulk hands. I couldn't even make a fist because they were inflamed. But again, it wasn't a chronic condition because it was just onset because of the accident. As were chronic, it would be something that was slow, progressive, and it was like an underlying disease that was causing that inflammation. So chronic conditions persist for a very long time. That range from months to several months, a few months to months. And different diseases have different time frames, so they're there for some extended period of time would be a generic way to go about it, to say it. All right, let's discuss exacerbation versus remission. So exacerbate, this is a combining form and it means to increase or to provoke. Right? Exacerbate, you might be familiar with that. So imagine someone who has asthma as a child and it rarely bothers him anymore as they get older. He could have an exacerbation of that asthma. So if you have asthma yourself, you know that you know what it feels like. You know what I'm talking about. You can have a perfectly normal respiratory status, and then something happens, something triggers it, and it causes you to wheeze. But in case of asthma, in cases where we're talking about asthma, again, it could be something like allergies, exercise, exposure to something irritable, some environmental toxin, like cigarette smoke. I don't see a lot of cigarette smoking now, but I see a lot of vaping. Um, so, in other words, something happens, and you could say it's an exacerbation of that disease where the disease is suddenly worsened. And then on the other hand of that, you have remission, right? Remissal means to send back. So remission is to go back or send yourself back to the original state of health. So in remission, you are clinically and physically appearing as if you didn't have that disease. So for example, right now I'm giving this lecture, my respiratory status is fine. You could say, if I had asthma, I'm in remission because you wouldn't really know that I have asthma unless I told you. But I don't have asthma. I'm just using it as an example. Um, Asthma tends to be something very, very common, so most of you can relate to that. You might hear that, right? So you hear me talk, you might think the professor does not have asthma, but if I did, the disease is actually still there. I just don't have any symptoms. Okay. All right, let's discuss this term sequela. And sequelas is something that happens and remains after a disease has resolved. So in terms of a sequela, some things arise because of that disease and persist after the disease is resolved. A good example, and I'm old enough to remember this, the chickenpox. People who had chickenpox as a kid, as children, right, as a kid. And there was no chickenpox vaccination at the time. Um, so if you got chickenpox, like everyone else, you had scarring from where the kids would scratch, right? The spots that got itchy. And so they'd have like little scars due to those chickenpox chicken pox spots, right? And it's there, even though if you can't see it, they're still there for adults today. And why you wouldn't look at someone and think, oh, what happened to that person? Um, someone else wouldn't necessarily have to see it. You would know it's there, and you could feel it, and it's like a different feel on your skin. So it's a scar, and it remains there even though the chickenpox has been gone from your system, decades ago. So sequela, something that lingers after a disease is resolved. Um, if I ask you for an example of sequela, don't use chickenpox as an example because um, that's going to be my first discussion question. So give an example of something else, but not sequela for your discussions when we talk about when you get into your discussions. Plus, we have a vaccine for that now. So that example would probably be only useful to people who are much older. All right, let's talk about refractory. Re means again and again, right? Fracto means to break up, and the suffix y means having the function of. So refractory means having the function of breaking it up again and again. So however, I understand that might not be very helpful for you because it lacks some specificity. In medical terms, when we're talking about the word refractory, it refers to a disease that does not respond to treatment. It could be a disease that initially responded to treatment, but for some reason no longer does. So for instance, individuals with cancer, they might undergo chemotherapy and achieve positive results initially, and after some period of time, the cancer may cease to respond to the chemotherapy. In those cases, we would say the disease is refractory to the treatment. There are things in the body that happen naturally, like your signal conduction, nerve conduction, your ECG, your heart conduction, and there's a period of time where you have these ions moving across the cell, causing a difference of potential, causing this signal to move down a tissue. And there's a part of that cycle that's called the refractory period. So after that initial movement of those ions move across, it creates a potential and it starts traveling down some tissue. There's a part called the refractory period in all these signals where it doesn't matter how much more of the ion of that chemical that gets moved back and forth, it's not going to cause anything to move any faster. So we have refractory periods in things like that, and signals and systems within the body. So refractory means refractory, no matter if we're dealing with a disease or if we're dealing with like signal conduction and so forth. All right, let's discuss another term, prognosis. Pro means before, noso means knowledge, and then osis is just a condition, right? A condition of. So the word prognosis, it means that healthcare providers have knowledge beforehand about what's likely to happen with a particular condition. Right? They've seen it before, and they can tell you what to expect. So prognosis relates to the expected course of a disease, and it can be either good or bad. For example, a good prognosis might be having acne, where the likely course is that it might worsen initially, but with medication, it's expected to get better. The individual is likely to live a long life, as acne is not really anything terminal, even though it may have some social implications. So in this case, the prognosis is very good, anticipating a positive response to treatment and the acne eventually getting better. It's the ability to predict the likely course of a disease. Another good one would be, what's that something everyone gets? The lymph node that's swelling, strep throat, right? Strep throat is very, very common, and when a doctor diagnoses a strep throat, they can pretty much tell you, okay, this is a sequence of treatment. You have to take this particular antibiotic for this duration of time, and it's going to go away by day 7 or by whatever. You'll start feeling improvement by this. So a prognosis, we know what to expect with the pattern of the disease, either with treatment or without treatment. If you have trouble with noso as your combining form for knowledge, you might have encountered it in other words like agnostic, right? So in the context of the internet and agnosticism, it refers to someone who says they don't have the ability to know about the afterlife or necessarily believe in God. The prefix a, that means without, and gnosa means knowledge. So someone who's agnostic is someone who literally, we're breaking it down, saying the word says they don't have the knowledge. In this case, of God or the afterlife, if someone's an agnostic, right? If we're dealing with religion. So this might help you recall the combining form for noso. As a tip for studying, if you come across a combining form and you get tripped up when you see it, if you can find an everyday word you already know that uses a combining form, it'll make it easier for you to recall. So prognosis may not be as common, but agnostic is an example of how you can make it easy for yourself to remember. Previous to this, I think we discussed the prefixes inter and intra, where we said interstate and intrastate. If you're dealing with highways, you can use a prefix or the word in an example that you do know, right? And it'll help you remember it in the medical sense. All right, let's discuss another pair, congenital versus hereditary. All right, sometimes these words are mistakenly used interchangeably, but they're not. Congenital means present at birth, right? So a congenital problem might be a heart murmur, which is a good example. Sometimes it might be congenital and that heart murmur might not pose any problems. The baby might be very healthy and like from a cardiovascular point of view is in good shape, good color, proper oxygenation and so forth, but the heart murmur is still there. It's present at birth. It doesn't necessarily mean it's a problem. It just indicates that this is something present at birth. On the other hand, hereditary, right, from the word heredito, it means genetic inheritance. So hereditary is something that was genetically predisposed for you and you inherited it from your genetic line. It can also be present at birth. Therefore, you could have something present at birth that is also genetically inherited, but there's a little bit of difference between the two of them. Hopefully that made sense. You can have something that's hereditary. You might not get it till adolescence or until you're older. All right, let's break down this next word, neoplastic. Right, neo, plasto, and IC. We can look at the combining form of this word and the suffix IC, which means pertaining to. I don't think I mentioned this before, but there's going to be a lot of suffixes that mean pertaining to, or something very similar to that. So, and we're going to use those very often. Right? They make good adjectives. And it'll save you a lot of time when you're trying to break down words. The root word here, plasto, with the combining form, that means growth or formation, and neo, the prefix, means new. So oftentimes when we use neoplastic, we're talking about cancerous processes, right? This is implied that you have this new growth, and it's used often in cancerous processes. So it's implied that like chemotherapeutic drugs, often referred to as neoplastic drugs, or anti-neoplastic drugs, meaning against a new growth. But literally, it just means pertaining to a new growth or a new formation. The implication here is that we're talking about something malignant or cancerous when we say neoplastic. Okay. Let's see what's next. All right, let's talk about iatrogenic, starting with the suffix, right? IC, that just means pertaining to. Geno means arising from, and you can think of Genesis from the book of Genesis, which is the beginning story. Iatro, the prefix means physician or medical treatment. So an iatrogenic disease is something that has been caused by either the physician or medical treatment, including the medical procedure. So some good examples are adverse drug reactions. You go to a doctor or a hospital and they give you some treatment and you have a reaction to that drug while you're there. They'll call that iatrogenic. If a physician prescribes 2 medications and another prescribes a third medication without the knowledge of the first ones, and that leads to some drug interaction because the interaction was caused by their prescription, we would say that's also iatrogenic because it was caused by the medical treatment and arising from medical treatment. Right? Another example is like aspirating fluid, which can be a procedure to address excess fluids, say in a joint. However, it could cause unintended secondary bleeding during that removal of the fluid, and so this is something arising from the medical treatment, the procedure itself, and so There's a long list of things that we would consider iatrogenic, but it's always implied to be negative or bad, and it was caused because of a procedure or a treatment, or it's physician related. It was related to your process of getting treatment in the first place. It wasn't an initial complication that would have occurred with the disease state that you had. All right, let's discuss idiopathic. Breaking it down, right? IC just means pertaining to. Pathos means disease. Idio means unknown. We use the word idiot a lot of times as like a slander or slur, but it just means you don't know. I'm an idiot about many things, and it's just a different way of saying I don't know this particular thing or that particular thing. But we use it in a way that its connotation is something negative, where its denotation just means you don't know. But we say he's an idiot. We're all idiots. You get the idea. So idiopathic means that the cause of the disease is unknown. So when you visit a physician or a nurse practitioner, one of the common questions is, why do I have this problem? Right? Not everyone necessarily wants to know the cause of their disease, and for some diseases, the reasons are still, mysterious. We don't know where they come from. However, like in Western medicine, there's a reluctance to admit not knowing. Nobody wants to. No one wants to others to know that they don't know. So idiopathic sounds much better than you're an idiot. If someone says a condition is idiopathic in nature, it means they really just don't know the cause of that disease. It's a disease of an unknown cause, making it an interesting word, a nicer word. Okay, let's discuss HAI. Technically, it's an acronym, and we'll talk about that in the next lecture. But you might have heard the term, an older term called nosocomial. Nosocomial is a term used a while back, in a long time ago, in the before times, and it's just fallen by the wayside. People don't use that anymore. You can still see it on tests though. It's still used out there. I just want you to be familiar with nosocomial because it's still a phrase that can be used. But the modern term is HAI, which is healthcare acquired infections. And nosocomial is the combining form that means hospital. So it pertains to hospitals. Consider this, you're in a hospital and they're inherently infectious, right? People go there who are sick. And so it's not a place you just want to hang out because you want to catch something, definitely go hang out at a hospital. So don't go there unless you absolutely need to be there. Sick people go there, they have bad viruses in some cases, they have viruses and bacteria they don't know they have, and they're in the cafeteria or whatever. So yeah, some people do know what they have when they go to the hospitals, and some people don't know they even have something. And what happens is that gets passed from person to person in the hospitals. So when we say nosocomial or an HAI, healthcare acquired infection, this is something that you pick up as a byproduct of just being in the hospital or receiving care from a healthcare provider. Nosocomial is that old school term, so make sure you know both of those. All right, let's cover some surgical terms. Reduction. This is a term you might have learned in math class. If you watch cooking channels and cooking shows, which I've been forced to watch many times, you'll see reduction in the context of reducing a sauce. Right? In the medical world, reduction means the realignment of a broken bone back to its original position. So we'll dive more into this when we reach chapters 8 and 9, the musculoskeletal systems. I just want you to understand what reduction means here. Resection, this is a surgical removal of something. So for instance, if someone has colon cancer, they might undergo a colon resection. You could have your appendix resected or any other organ resected. Excise means to remove by cutting. So it might seem like we're splitting hairs here because they're very closely related terms. Resection is commonly used with internal organs, while excise is typically applied to more superficial things. So for example, if I had a suspicious mole on my arm, a mole that wears a trench coat and sunglasses, and that mole wasn't there before. And the mole's looking around. It's like, I might have to have that mole excised. Right? So hopefully you see the difference there. So don't worry too much about these nuances right now. You'll pick them up naturally in your profession, or we start going to your clinical rotations, or while you're in school or on the job. It becomes second nature, so don't stress about it too much right now. We're just kind of introducing you to a lot of these terms. I don't expect you to have these terms memorized and know them by heart yet. All right. These surgical suffixes were introduced to in chapter 1. I'm going to emphasize them now because you're going to encounter them in every chapter. I want you to learn them, which means you should memorize them. And I know we mentioned don't memorize things in college and focus on critical thinking, but until you know these suffixes cold in your sleep, you'll need to memorize them. So ostomy, I sort of hinted at this one. It refers to the surgical creation of an artificial opening. Right? You've likely heard of colostomy, right? So this is a surgical creation of an artificial opening in the colon, and the opening is called a stoma. The stoma literally translates to mouth, right? So this is an opening, and we'll discuss this more throughout the semester. Otomy, O-T-O-M-Y, without that S, that refers to the surgical incision. So to create the stoma, surgical incision must be made. And so just pay attention to the S and the T. So between stoma and otomy, as they make all the difference in the meaning of the word. Okay? So you need to do otomy before you do an ostomy. Ectomy, E-C-T-O-M-Y. See, these words sound very, very similar. New word I just made up, familiar. Refers to a surgical excision or removal. So, for example, an appendectomy, this involves the surgical removal of the appendix. You can use any combining form for an organ in front of ectomy. So, you'll have a term that means the surgical removal of that organ. Plasty refers to reshaping something surgically. So, for instance, knee replacement is known as arthroplasty. Right? Michael Jackson made this term common, especially with rhinoplasty, which involves reshaping of the nose. He had rhinoplasty, and that's the medical term for a nose job. I'm surprised to know that a lot of high school students get nose jobs, get rhinoplasty. I don't know why they get something at such a young age. But in the past, this wouldn't have been heard of, but now it seems to be common. Suture, is this almost impossible to say without the combining form suturo? And that just means the process of suturing. So for example, the spleen, if it's lacerated due to an injury, the surgical procedure to suture it would be called splenophraphy, right? Splenophraphy. So if the spleen is beyond suturing, remove it, it will be a splenectomy. So again, learning these suffixes are going to help you understand the details of surgical procedures. And in every chapter, we're going to cover some surgical procedures. Okay? Did it move to the next slide? Not yet. There it goes. All right. Examination terms. This first one that comes into play is when people undergo a physical exam, right, conducted by a doctor or a nurse practitioner. Examination. And these terms are going to be used throughout the rest of the semester. So inspection, first of all, involves looking at something, and it's often the first step in a physical exam. So a healthcare professional visually inspects the patient, assessing their overall appearance, checking for signs of health, pain, or respiratory problems. An inspection can range from a general overview to a more detailed examination as depicted in this image here, where the individual appears to be closely examining the patient's palate or perhaps the back of her throat, or his throat, his or her throat. Palpation, you might have heard of this. This is supposed to say palpation, not palpitation. Palpitation. I should have fixed this already. And I'm doing a recording. It's too late now, but this should say palpation. So And autocorrect is not going to correct this because palpitation is an actual word as well. It's just probably going to think that's what I meant. Um, if you look at the combining form, palpato, that means touch or feel. So that's what we're talking about. I'll correct this later. This is palpation, to touch or feel. So you've already done this yourself. What is it that you do when you think you're getting a cold and your throat hurts, right? You start doing what everyone else does. You put your hand around your throat, you start feeling for soreness, right? And so you're palpating. You take your fingers, you start touching lymph nodes. You probably don't even know that you're actually feeling for lymph nodes, but that's what you're feeling for. You're feeling for those that swollen um, uh, areas within the throat, right underneath the jawline. And you think, oh, am I getting sick? Right? And you feel those nodes swelling, whether you knew there were lymph nodes or not. So this is touching and feeling, and this is palpation. All right. I wonder if I fix the spelling, the recording will stay. So I'll be talking about a misspelling that you won't see is there. I might just leave the misspelling and the recording together. All right, let's keep going. Percussion. This is to create noise. So percusso means tapping. If you were in the band, you know there's a percussion section, right? So this is using tapping to be able to hear with just a naked ear some noises. So in this example, this woman is percussing the patient's neck. So in percussing the back, right in the thorax where the fingers are, you have lungs and they should be filled with atmospheric air. So they should have a very nice hollow sound. But if you percuss and you hear a dull hollow or a dull sound, you know that there's something abnormal in there. That's not just air. So this is a very, very gross kind of general broad way to be able to listen. Gross, I don't mean like disgusting gross. Gross as in like a holistic, large perspective to kind of look at something. Not like, ugh, gross. And you can see people percussing the abdomen as well, anywhere where they need to hear sounds. All right, auscultation. Ausculto, that means to listen, right? So listening with a stethoscope. So it's not literally translating. In this case, we're really listening with a stethoscope, listening for those fine sounds. So when percussing, I can tell if a person maybe has a little bit of fluid in the lower part of the lungs, but I can't hear any of those details. The stethoscope, I have a hard time saying the word stethoscope because of my accent. I guess I do have an accent. The stethoscope, excuse me, allows for a very, very detailed examination using your ears and listening to like heart sounds, listening to breath sounds. With it, you can listen to digestive sounds, and so forth. Hopefully I don't have to say the word stethoscope too much. And the last lecture, okay, up next is the last lecture, and we're going to cover some abbreviations and some acronyms. All right, so let's go jump right into it. All right, so let's jump into the discussion of abbreviations and acronyms in this third lecture of Chapter 2. And if you have any specific questions or if there's a particular part you'd like to discuss, feel free to let me know. I'm probably going to have this recording up as one giant recording. Later on, I might split it up into 3 little pieces so you can have 3 smaller parts. I have the software to do that, but I think I'd rather have fewer recordings in my YouTube channel. Oh, and this will all be up on my YouTube channel. Okay, let's refine and complete the paragraph for better clarity here. So there we have it. First, we're going to go alphabetically because it's just easier for most people's brains. The first one here is ADL, right? As far as abbreviations and acronyms. And ADL means activities of daily living. And these are things like getting dressed, bathing, feeding yourself, brushing your teeth, activities that everyone does as part of taking care of themselves. And I'm assuming everyone bathes and brushes their teeth. A&P, this could mean 2 things. It can mean either auscultation and percussion, as we discussed earlier, or, we've been using A&P for anatomy and physiology. But when we're dealing with healthcare, right, it's going to mean auscultation and percussion. In academia, A&P probably means anatomy and physiology, unless you're in a medical term class, which it could mean either. Right? You might have used the acronym A&P when you were registering for classes or when you were going to your A&P class, right? If we have A&P with no ampersand, that little and symbol, it's AP, app. This usually means antero-posterior, and this is going from front to back, right? Anterior, posterior. Physicians will order chest x-rays using the AP approach. Let's say, give me an AP chest x-ray. So going from the front to the back. BP means blood pressure, and you probably already know this one. That's pretty common. It's sort of shorthand for blood pressure, yeah. BX, this is another one. And that's usually shorthand for biopsy. So biopsy is like taking a piece of tissue out for analysis. And my slide does not have BX popping up there. But anyway, BP and BX should be here. All right. Here's another one, CAUTI. I'm pronouncing that the way so you can know that there's the letter C-A-U-T-I. CAUTI is the way it's pronounced. You'll hear people pronounce it Katie for some reason. It's just easier seeing CAUTI, C-A-U-T-I, to know that it stands for catheter-associated urinary tract infection, right? And so if you say, I say it that way so you can get the idea of all the different letters that are there, because each letter represents something. So very commonly during surgical procedures that require, say, general anesthesia, a urinary catheter will be placed. So those need to be removed within like the first 48 hours after surgery, which is typically the rule of thumb, because longer than 48 hours, that's associated with an increased risk of urinary tract infection. Right? And then we have another term called CLABSI, which is C-L-A-B-S-I. It stands for central line associated bloodstream infection. And I don't have that one. It's not popping up yet. I'll have to make sure I put that on the slide as well. So the same rule applies here. You can use central lines. Instead of having an IV in your hand, these are intravenous lines that are placed in major vessels, and they can be a source of infection as well. So that's CLABSI, and then CT. You've heard of this before. People say, I'm going to go get a CT scan, and CT just stands for computerized tomography. So it's a X-ray of the, not the entire body, but a 360 picture of the body. It could be the entire body, or it could be a section of the body. And a computer is actually used to take all those different individual images and stitches them together to give you this, one nice full image of the body in X-ray form. All right, let's go on to the D's now. D's, DC with no slash. This means discontinue or discharge. So how you're going to know the difference is going to be in the context in which you see this. Right? DX, this is shorthand for diagnosis. EHR, this might be very familiar to you now, maybe not in the 2010s and 9s back in the earlier days, but now it's a very common thing. Electronic health record, right? We also have something called EMR, and that stands for electronic medical record. The question is, can they be used interchangeably? Yes, they can. The medical record and the health record do have technical differences, but by and large, these terms are generally used interchangeably. All right. ETO, E little t, capital O, capital OH. This is a chemical formula, and it just stands for alcohol. Right? It means, I think it's for alcohol, but I want to say it's like ethanol. SSI, surgical site infection. Just like anything else where we have something done that's invasive, like a urinary catheter or that central line that we mentioned, you don't want to get infections there. So This is something that can happen when you got a surgical site. Like, so if surgery happened in a particular place, you want to make sure that there's no infection around that area where you compromise the skin. VAP, ventilator associated pneumonia. We're going to talk about pneumonia later in the semester, but people who are on a mechanical ventilator where the machine is breathing for them, they're at a higher risk of developing pneumonia. So we call this ventilator associated pneumonia. They get it because they're of the treatment, right? All right, medications. For those of you in pharmacy, some medication administration items that you should know. And again, it does help if you speak Latin, you took Latin in high school, or in some cases, if you speak Spanish, which is a Latin-based language. Some of the language is very easily translatable to its original Latin. For the average person who doesn't take Latin or doesn't speak a second language, these words can get a little difficult to get used to, but let's go ahead and get started. So AC, this means before meals. The Latin term here is antecebum, right? That's what it stands for, AC, antecebum. How would you know that? Well, that's going to be handy if you're ever like on Jeopardy and you get one of those questions of some trivia that most people don't know, right? But how would you know that? You took this class. That's how you know that. We know that the word, we go a little further into it, ante, A-N-T-E, that just means before, right? So if I said like antepartum, that's a time before giving birth. Antebellum, that just means before the war, right? Antecebum is before the meals. Again, it can be a bit obscure, but if you remember ante, A-N-T-E, antes, if you speak Spanish, just means before, and you'll know this means before meals, AC. It didn't take me that long to learn most of the abbreviations in pharmacy when I worked in pharmacy. We didn't have pharmacy tech schools back then. So we just wrote these down and learned them all. If you get a medication and it says AC, that means you're supposed to eat and not have any not eat and not have any food in your stomach, right? So before meals. So I was going to say you have to eat. With meals is something different. So yeah, AC meaning before your meals, take the medication like on an empty stomach. And so you see the prescription written down as AC. PC now, where the P means post means after meals. So taken after a meal, PC. AC, before meals. PRN, this is another term that you might be familiar with. It's a Latin phrase, and you don't need to know what it means, what the Latin phrase is, but it means as needed. PRN translates to as needed. So you'll see this with pain medication, right? They'll say take this medication every 4 hours or as needed, right? So if you need it more frequent than that, take it. If you don't need it at the 4th hour because you don't really feel like you're in pain, then don't take it. It's preferably that you don't take as much medication as possible. Take as little as you need when it comes to that. Right? You won't see that with antibiotics. It won't say take antibiotics every 4 hours as needed. No. With antibiotics, it's a little different. They want you to finish the whole thing. And so take every 4 hours, whether you think you need it or not. But pain medication is one that you kind of gauge for yourself. You take it if you're in pain, and if you feel fine, when it says recommended taking it again, and you shouldn't have to take it. What else? That's it. HS. Again, if you know Spanish, this might help you. If a medication says take and has HS on there, that means take at bedtime, right? HS means hora, like H for hour. Somni, and somni, is related to sleep, right? So hora somni meaning the hour of sleep. So if it says take medication HS, usually means take at bedtime. Or that's the way we translate it. Take before you go to sleep. and not like a day nap or a morning nap. It usually means nighttime, bedtime. The usual normal time when you sleep. So if you're given a prescription for Ambien, for those of you in pharmacy, it will be written HS, so take that one at bedtime. Don't take it early in the morning. Then you'll be asleep early in the morning, and you shouldn't be driving. All right, a few more slides and we're done with this lecture. So PO means by mouth. So if you're going to have trouble with this, remember that, like the little emoji, that O is going to look like a mouth. Like if you're making a surprise face emoji, so PO is by mouth. PR, you can imagine that means per rectum. So for example, enemas are given per rectum. Sometimes you do have to specify that, so people would know. What else? Oh, another thing, for those of you in pharmacy, you don't want to include the abbreviations and the instructions for the individual. So if you get a prescription and it says take this, enema PR, you don't want to write that out on the prescription bottle because the patient doesn't know what PR is. It's up to you to translate it into a common language so that the patient can actually read it and understand it. I used to see a lot of abbreviations on the prescription bottles, and technicians would just write out whatever the doctor wrote, which I thought was very odd. SL stands for sublingual, right? Again, if you speak Spanish, lengua, lingua is Latin for tongue. Sub means underneath, so some medications will say take SL, so take sublingual. You place the medication under your tongue. It's usually something that's going to dissolve real quickly and it gets absorbed real quickly that way. These changes, right, they mainly involve adding some punctuation or clarity and adjusting the structure of a couple of sentences for these things to move smoother, right, when you write these things out. So make sure that you change the abbreviations into full words so that the patient can understand what it is the doctor's saying. It makes no sense for you to copy exactly what the doctor wrote to the patient in case the patient didn't understand the original instructions to begin with. All right. Parenteral, right? So parenteral routes of administration. We're still on pharmacy here. This is not by mouth. So some of these you kind of already know. IM, intramuscular, you might know that one. Right? So if you get a flu shot is something that's IM. Versus something like insulin shot, with a subcutaneous, right? Meaning it's in the subcutaneous layer of the dermis. IM meaning intramuscular, it will go into the muscle. So you would assume that an intramuscular shot is a bigger needle. Pain medications can also be given intramuscular, IM. IV, intravenous, right? So you know that intra means within the vein. So intravenous is, and you think of the word IV, it's something that goes into the vein. SQ is the abbreviation for subcutaneous. Now, subcutaneous has several different abbreviations depending on what part of the country or what part of the world you're from. So we use the abbreviation SQ. Now you'll notice that subcutaneous, S stands for sub, but cutaneous starts with a C, right? C-U-T-A-N-E-O-U-S. It's like, where does that Q come from? Right? So anyway, this means cutaneous, underneath the skin. So people who like take blood thinners, for example, they go to the hospital, they're giving blood thinner medication subcutaneously. Or insulin. Insulin is given subcutaneously if you're diabetic. Right? But going back to subcutaneous, there's no Q there. And this is something that's been a phonetic association. Sub-Q, meaning like the CU from cutaneous. We've just eventually, it just turned into the letter Q. And we say sub-Q. And we'll write it out as S and Q, but it really refers to subcutaneous. If we're going to write this down as an abbreviation, we would say SC, which is actually used in some places. SC meaning subcutaneous, SQ meaning subcutaneous. I think I've also seen There's 4 different versions of subcutaneous. SQ, SC, subQ. I can't remember the other ones. One of them might be SUB, like subQ. So people understand it means subcutaneous. Anyway, there's several different ones, but the one for this class is going to be SQ. If you see it written in some different places, yeah, it's just the way it is. It's one of those that just you have to know it and its variations. ID, right? ID means intradermal. So if you ever had a TB test, when they put that little bit of medication or that in your right underneath the skin, right? They'll put that little fluid in there and it goes under the skin. It's intradermal, and they wait to see if there's like a reaction later. What else? Oh, that was it. That's the last slide. Thank you for making it this far. I know my voice is getting dry and it's hard for me to talk. But you made it to the final lecture, so you might see this as one long lecture, or you might see this as 3 little lectures. What we're going to do next, what you're going to do next, is do some exercises that are posted on the course. There's discussions that you're going to do. There's quizzes to sort of reinforce this information. I want to thank you for your time. Thank you for sticking around. And I will see you on the next season, which will be a whole new chapter. Thank you.